These next few videos are going to be on the liver and the gallbladder. We said the liver and the gallbladder are from your foregut, they're from your duodenum. So here's your duodenum. And we said that little buds will start to form during embryology, and those buds will eventually become your pancreas, your liver, and your gallbladder. And so these next few videos are going to be on the liver and the gallbladder, and we'll start with the liver. Your liver does a ton of things, but we're going to try and keep it within the confines of what it does in the GIT. So what does your liver do for your GIT? Well, it loves to take things up, take nutrient-rich blood up, and metabolize it, digest, help store glycogen, create glucose, gluconeogenesis, all that stuff, and also will send things back. So it'll take things up and it'll send things back in the form of bile. It'll produce bile, and bile just helps us digest fat. Now, how does it take things up and send things back? Well, you know that your liver is connected to your duodenum by a ligament. Do you remember which one? That'd be your hepatoduodenal ligament, right? Hepatoduodenal ligament. And what is contained in that ligament? If you said your portal vein, if you said your hepatic artery, proper hepatic artery, and if you said your bile duct, common bile duct, you would be right. And that's sometimes called the triad. The triad. And so the first two help you take things up to the liver, take blood up to the liver, help the blood get processed by the liver, you know, clear toxins, metabolize things, digest things, all that good stuff. So your portal vein will take blood from your GIT, blood from GIT to your liver. Your proper hepatic artery will take blood from your systemic circulation. Blood from systemic circulation. Blood from systemic. These are both uptake, things going up to your liver. Your common bile duct is what goes out. Common bile duct is what goes out. So this is what releases bile. Release bile. Now just write output. And these three, these triad, they're best friends. Yeah, they always like to stay together. They always have to stick together. And even when you start to create little branches, tiny little branches, all in your liver, all three will continue to stay together. So even your little branches, even your little tiny branches will still contain all three of them because they're best friends. They have to stay together. Even your tiny little branches will have these little triads. All right? And these triads are so important that the cells of your liver, your hepatocytes, will kind of circle around these triads. So if we draw it out, we'll say here's a triad. So here's a triad. Here's one. There's got to be a better way. There's got to be a better way, but we'll say these are your triads. Then your liver cells will circle around these triads because they're so important. And the blood from the first two will kind of trickle in and supply your cells, supply your liver, and eventually drain into the central vein that we call the central vein, which is just part of your hepatic vein, and that ultimately goes to your IVC and drains your blood. So all this blood will kind of trickle in to the center. Yeah? How does it trickle into the center? Well, they're connected by something called sinusoids. Sinusoids. And sinusoids is just a fancy way of saying capillary. Just a capillary, yeah. So they're little capillaries that connect it to, and they're fenestrated, which means they have holes, so blood can kind of leak through and supply your little hepatocytes, your little liver cells. So I'll write fenestrated capillaries. Which connected to, and the blood will be able to flow through. In your sinusoids, you also have little macrophages that kind of look at the blood, make sure there's no baddies in there. We call those Kupferr cells. Kupferr cells. Let's just draw some Kupferr cells. Blood will be able to flow through. One more thing that they kind of want you to know, the space between the sinusoids and the actual liver cells, the hepatocytes, is called the space of Disse. Space of Disse. And blood will be able to leak out into the space of Disse and supply your hepatocytes. And the space of Disse is very important because it contains something called stellate cells. Stellate cells. And stellate cells store vitamin A. That should be important enough. You might have heard, like, if you eat an animal liver, certain animal livers, you can die from vitamin A overdose. Well, that's because the liver has stellate cells and it stores all your vitamin A. If you eat the animal liver, you can die from vitamin A overdose. All right, vitamin A. But one of the most important things is that when these cells are damaged, these stellate cells are damaged, they will release TGF-beta and signal fibrosis. Yeah, signal collagen production, fibrosis. So they make fibrosis when they are damaged, and that's very important to note. Just keep that locked in the back of your mind when we talk about liver pathology. But it's your stellate cells that make fibrosis. All right. This is a general functional unit of your liver. You have a ton of these all over your body, and they're just circled around your portal triads because I say they're very, very important. Now, let's just look at this in a little bit more detail. Let's just kind of like blow this up, kind of enlarge it. We have our portal triad with our portal vein, our common or our proper hepatic artery, and our bile duct. And we said that your vessels will eventually drain through your sinusoid into your central vein. And kind of supply the hepatocytes as it does that. So all the blood from your two input regions, so all the blood will drain. How about your bile duct? Well, your bile duct is output, right? It has to leave, so it actually goes the opposite way. So your bile ducts will go the opposite way, and it'll leave there. We can break this into 3 different zones. We can break it into zone 1, zone 1. And zone 1 we call your peri-portal zone. Peri means around, so around your portal triad. And around this zone, there's some certain pathologies that really like to affect the zone. One of them being ingested toxins. So if you ingest something bad, then it'll go in, and the first thing it hits will be this zone. Okay? So ingested toxins, the first thing it'll hit is zone 1, so it makes sense that it will damage this zone. Also seems that viral hepatitis likes to damage this zone. Zone 2, we call the intermediate zone. Intermediate. And there isn't too much to know about this other than it can get damaged in yellow fever. Yellow fever. That's your flavivirus, remember? Just a little bit of micro throw-in. And then lastly, we have zone 3, which is around central vein. Sometimes we call zone 3 pericentral, again, meaning around the central vein. Sometimes we call it central lobular, which is in the middle of the lobule. So either way you cut it, it's right in the middle. And zone 3, there's few important things you need to know about zone 3. One is obviously the farthest away from the blood supply. Obviously the farthest away from the blood supply, so farthest from blood. And because it's farthest away from blood, it's the most likely to get damaged from ischemia. Next, this zone contains most of your P450 enzymes. That's the thing that helps you metabolize things like drugs. And so, this zone 3, is highly susceptible to drug toxins. And then last but not least, alcohol seems to affect this zone. So they like to break it up into zones, and they'll talk about someone who has viral hepatitis and then ask, you know, what zone's affected, or yellow fever, what zone's affected. If someone has liver damage from a drug, what zone's affected. So you gotta know the zones well. Those are the zones. That's kind of what your liver is broken up to grossly and microscopically. Now I just want to touch on a side note, something that is important. You need your GIT to send blood to your liver to help aid in metabolism and digestion and all that. And we said that your duodenum sends blood to your liver. Fine and dandy, but that's not the only part of your GIT that sends blood to your liver. It also includes your esophagus, your intestines, your anus. So let's just take your esophagus for example. Here's your esophagus. It has little blood vessels that will drain blood back to the heart, which is normal, what it normally does. But it also have little branches that will connect to your liver and send some of that blood to your liver. Yeah. Here's the problem. If there's anything wrong with your liver, then the blood vessels in your liver can get destroyed. You can suffer from hypertension. We call that portal hypertension. And when those vessels get destroyed, then that blood can't go to your liver, and it'll start to back up and back up and back up and start to dilate these veins. Dilate these veins. We call these dilated veins varices. Dilated veins. And these are incredibly dangerous because they can dilate to a point where they rupture and then blood just pours everywhere. If it's in your esophagus, you just have blood pouring out of your esophagus. You can suffocate from that blood. Yeah, it could be an emergency. And so you gotta know these little veins, these little vessels that can dilate. So in your esophagus, the vein that goes to your liver is called your left gastric. And that connects to the vein that goes back to your heart. The branch that goes back to your heart, called your esophageal. Alright, so if there's something wrong with your liver, then these veins can dilate, cause those esophageal varices that can rupture, blood can pour out. Another part of your GIT that connects to your liver is going to be your intestines. So there's a branch that goes to your intestine and a branch that goes to your heart. Especially around your umbilicus. So the one that goes to your liver is going to be your para-umbilicus. And the one that goes to your heart is going to be your epigastric. And if there's something wrong, then these veins can dilate, and you see these dilated veins on your stomach. Yeah. Sometimes they call it caput medusa. Caput meaning head, so the head of Medusa, because all these dilated veins kind of look like Medusa. Lastly, in your anal region, in your rectum, there's your rectum. You have a vessel that goes to a branch that goes to your liver, a branch that goes to your heart. The branch that goes to your liver is your superior rectal. The branch that goes to your heart is going to be the middle and the inferior rectal. And Pathology here, these veins can dilate. These are not the same as hemorrhoids. We said hemorrhoids were those superficial submucosal veins that dilate due to constipation. This is not due to constipation. This is due to liver damage. So these are not hemorrhoids. Not hemorrhoids. How do we treat this? Well, we can give beta blockers as prophylaxis, kind of reduce that blood flow. Triad also seems to reduce that blood flow. We can band them. We can even add in a shunt. Put in a shunt. And that shunts blood away from the liver, kind of reduces that hypertension, kind of reduces that pressure. So you can add in a shunt. Now, what causes liver damage in the first place? Well, we're going to talk about that in our next video, but any kind of liver damage can lead to these dilated veins. Something very important that can really damage the liver is Budd-Chiari syndrome. Budd-Chiari. Budd-Chiari. Budd-Chiari is when you have thrombosis of some sort of vessel to the liver. So let's say there's a thrombosis right here. Well, that's going to have an immediate blockage of blood supply. So you have a thrombosis. You have an immediate blockage. And you'll see that immediate blockage. All that blood is going to congest your liver. You're going to have nutmeg liver. Nutmeg liver. You're going to have those varices. You're just going to have dilated veins all over the place. So you have the varices. What you won't see is jugular venous distension, elevated JVP. Why is that? Well, that's due to inability to drain into your superior vena cava, into your heart. Is there anything wrong with your heart? No. Is there anything wrong with your superior vena cava? No. So that's the easy way to differentiate Budd-Chiari from like heart failure. In heart failure, you can't drain into your heart, so you have elevated JVP. Here, no JVP. Okay. All right, so that was just varices. That's just a little side note on varices. Let's just go back to our initial talk on the function of the liver. We said the function of the liver is to take blood up from your GIT and from your systemic system, and it needs to take that blood up because it helps us detox things like alcohol, which is its well-known function, detox from drugs. But even then, there's detox from natural occurring substances like ammonia. You can't build up too much ammonia or you'll die from that. Things like too much estrogen. It needs to uptake nutrients because it's very important for gluconeogenesis, for storing up glycogen. And it needs all that nutrients because it also synthesizes a ton of protein. Synthesis of protein, a ton of proteins. Virtually all the proteins that you can think of. The most abundant albumin, it makes that. Clotting factors, it makes that. So basically any protein you can think of, it usually comes from your liver. All right, so it makes sense that so much blood and nutrients has to go to your liver. And then of course, the output part, making bile, making things like cholesterol and bile. Making cholesterol/bile. What will happen if something goes wrong with your liver? Pathology of the liver. Well, you won't be able to detox anymore. You won't be able to detox ammonium. So you get asterosis. That ammonia can also go in your head and cause encephalopathy. So encephalopathy. If you can't break down estrogen, then you have gynecomastia if you're a man. You have spider nevi, which is dilation of small blood vessels, spider nevi. We talked about the varices, so you can have varices, portal hypertension. You can't synthesize protein, you can't make albumin. You lose oncotic pressure and you get ascites, basically a bunch of fluid in your belly. Ascites. You can't make clotting factors, so you have bleeding tendencies. Bleeding tendencies. All of this comes from something going wrong with your liver. And it can be kind of difficult to recognize initially, but the more questions you do, the more comfortable you'll get with it, the more easy it is to recognize. Yeah, patient will come in ascites, asterosis, maybe have altered mental stage from the encephalopathy, gynecomastia, bladder nevi, all that stuff. They're talking about someone who has a liver problem. All right. I'm talking about someone who has liver problems. Now, what are some labs you can order to look at liver health? The most common is going to be your AST, ALT. AST stands for aspartate aminotransferase. ALT stands for alanine aminotransferase. These things transfer amino acids around. All right, AST transfers aspartate around, ALT transfers alanine around. So just, if that sounds pretty non-specific, it's because it is. These are just enzymes found everywhere and they transfer amino acids around. It just so happens, because your liver does so much metabolism, it just so happens it's seen a lot in the liver. But know that it's found everywhere else, all right? So if something's wrong with your liver, then your cells will die and release these into the blood. And you see those elevated enzymes and you say, oh, there's liver damage. Liver damage. That's something you should know, is that AST is found more in the mitochondria. ALT will not be exclusively liver specific. It is at least more liver specific than its counterpart, so more liver specific. And the way I remember is there's a L in ALT, there's an L in liver. Why does this matter? Well, when you're ordering labs, you can look at the ratio, and in most liver pathology, they'll both be raised, but ALT will be higher than the other, because ALT is more liver specific, so it just makes sense that in liver pathology that ALT will be more higher. However, the only exception is in alcohol damage to the liver, alcohol hepatitis. Why is that? Because alcohol is a mitochondrial poison. And so here AST will be elevated as compared to ALT. All right, the memory aid and first aid I actually like and I use a lot is toast. There's an AST in toast, kind of like you're toasting anytime you take a drink of alcohol. So that's a good way to remember that AST is raised in alcohol hepatitis. Now these show damage to your liver. What they aren't are liver function tests. All right, don't ever say to an attending or to your CBO, PBO, oh, I would order the liver function test like AST, ALTs. That's wrong. These are not liver function tests. They just show damage, but they don't show whether or not your liver is still functioning. If you want to order a liver function test, then you have to think to yourself, what does your liver do? Well, your liver makes things like clotting factors, makes things like albumin, so you can look at those. So actual liver function tests will include things like albumin. And if your liver is damaged, then albumin will be low. It won't be able to make that. Your clotting factors will be low. And if your clotting factors are low, then you bleed all the time. So you have increased PT and PTT. These are actual liver function tests. That's something you gotta know. Not only for this step, but for your career moving forward. So these are the things that you will order, especially increased PT and PTT. All right, so our next video is gonna be on liver pathology, but I just want to touch on liver damage really shortly. Your liver has regenerative ability, but it reaches a certain point where it just can't regenerate anymore. And anytime there's damage, your liver can undergo fibrosis. What cells mediated fibrosis? If you say your stellate cells, you're absolutely right. So your stellate cells will mediate fibrosis. And fibrotic tissue can't function anymore. And if you keep damaging the liver, then you'll have more and more fibrotic tissue to the point where your liver function just stops. All right. So you just have constant liver damage. We call that cirrhosis. Cirrhosis. And you can actually see cirrhosis grossly. You'll have you'll have nodules of fibrosis. The liver will no longer be smooth, it'll be nodular. You can see that grossly. You can also look at that microscopically, where you'll see a small amount of functional liver cells surrounded by fibrosis. and that makes those nodules. All right, we call all that cirrhosis. And what are some causes of cirrhosis? What are some causes of liver pathology? By and large, the majority is caused by alcohol. And then some other causes include things like hepatitis, things like hereditary diseases. And we're going to talk about these in our next video. This video is just to go over some anatomy of the liver. Hope you enjoyed it. Hope it clarified some things. Thanks.